Hello, everyone. Greetings for the day. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown color patches on their face. They look like freckle, like spots forming large black patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to a study conducted across 4 Indian cities, reveals that more than 80% of the population presents skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spots and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women 90% and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation, generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hassles and to keep you informed, today we are here to know about the management of melasma from an expert, Dr. M. Preethi from Chennai. Dr. M. Preethi is a dedicated dermatologist with a solid educational background and clinical expertise. She completed her MBBS from Chettinad Medical College and pursued her MD in dermatology, venerology, and leprosy DBL at SRM Medical College. With wealth of professional experience, Dr. Preethi currently practices at GS Skin Clinic in Kandhachavadi, Matapita Hospital in Kovalam, and Unnata's Hospital in Kazipattur. Her professional interests lie in procedural dermatology and cosmetic dermatology, reflecting her commitment to enhancing patient care and aesthetic outcome. Today, we are privileged to have her with us, and she will be sharing insights on melasma and its management. We extend our heartfelt gratitude to you, Dr. M. Preethi, for joining us.
Thank you. Thank you so much.
And Doctor, without further delay, we would like to start with the topic that is melasma. So first of all, we would like Dr. Preeti to tell us what is melasma. Yes, doctor, what is melasma?
Melasma is a chronic skin condition. Chronic meaning it will be present for a long period of time. It usually starts as brown patches over the face and it progressively increases in size. And it increases in size and diameter as well. It is present for a long period of time. It is usually an acquired condition. Acquired meaning it is not present from birth. It can develop later in life. It is usually symmetrical. Symmetrical meaning it will be present on both the sides of the face. For example, if it is present on one cheek, it will be definitely present on other cheek as well. It has irregular borders, meaning the border of one side and the border of the other side is not the same.
Which are the parts or locations where we mostly see melasma, doctor? Is it just the face or other parts of bodies are also included?
Face is the most commonly involved. Face, the most common sites include cheek, forehead, nose, upper lip, chin, and jawline. Other than face, it can occur on the neck and arms.
Okay. And doctor, what causes melasma?
There are many factors involved in causing melasma. The most important factor is sunlight exposure. Both UV light and visible light can cause melasma. Usually, sunlight will produce free radicals that will cause damage to the skin and there will be pigmentation production. And the other factors include family history. Those with a positive family history will definitely have melasma. And the other causes hormone use of oral contraceptive pills, or because of the hormonal changes that occur during pregnancy, melasma can occur.
Okay. As laymen, people are not very much aware of the term melasma, but then they know about hyperpigmentation or pigmentary disorders. So, are they the same thing, melasma and hyperpigmentation, or are they different, doctor?
Hyperpigmentation is a broad term. There are many conditions which come under hyperpigmentation. Melasma is one of the hyperpigmentary conditions. So melasma is a term that comes under the broader term called hyperpigmentation. Every hyperpigmentary disorder, treatment will be more or less the same.
Right. Are there any signs of melasma? I'm sure it doesn't happen over the night. It gradually increases and spreads. So, what we see initially, doctor, on our face, on our skin as melasma?
Initially, it's small, starts as a small brown patch. As you said, it starts like a freckle or lentigine, then it gradually increases in size. It becomes more darker in color. It is usually present bilaterally, that is on both the sides of the cheek, both the sides of the forehead. Sometimes it can present in the central part of the forehead alone as well. So usually it's asymptomatic. Patients have no complaint, like they don't have any itching, pain, burning sensation. There is no symptoms at all. Signs on eliciting certain few investigations, we can find out whether it is melasma or not.
Right. When a patient comes to you, doctor, are there any tests that you normally recommend, or just by clinical investigation, you're sure that, yeah, this is the melasma, this is the grade of melasma, and then set the line of treatment?
It is usually easy to diagnose melasma on clinical backgrounds itself. Just by looking at the patient, we can come to a diagnosis of melasma. If in doubt or if when further confirmation is required, then other tests can be performed, such as Woods lab examination. In Woods lab examination, the color of the melasma will be more enhanced. This is even more epidermal type of melasma. The color enhancement will not be seen in dermal type of melasma. If needed, biopsy can be done. Usually, biopsy is not done, but if needed, biopsy can be done. And there is another investigation called reflectance confocal microscopy. If needed, in the rarest occasion, we can do it. Otherwise, not necessary.
And doctor, what are the treatment options available?
The first step is sun protection. Strict sun protection is a must because sunlight is the main enemy for melasma. It is better patients use broad spectrum sunscreen with an SPF at least 50 should be present. We usually recommend SPF 30, but in melasma, it is better to go with a higher SPF 50. Tinted sunscreens work well for melasma. So the sunscreen should have a broad spectrum coverage. Plus of 3+ should be present. Physical protection like umbrella, cap, covered clothing, all these could also definitely help. So first step is sun protection. So other medications include both topical, that is creams application as well as tablets can be given. Always combination therapy works better for melasma. Creams containing hydroquinone, tropical steroid, acid, azelaic acid, alpha-arbutin, ascorbic acid can be given as oral formulation. Even topical vitamin C serums can be given. Licorice extracts can be given. Other than it, orally tranexamic acid does wonders for melasma, which works well for melasma. Then chemical peeling and lasers can also be done. Chemical peeling like glycolic acid, azelaic acid, chestnut peel, phosphonate peel can be done. Laser toning works very well for melasma. So it's always a combination approach that works well rather than a monotherapy. But the drugs which I mentioned have a lot of side effects. They should not be taken without doctor's advice. So we give the patients, we monitor them, and we stop them when needed. Without doctor's advice, using the medications is a big no.
As you said, these medications, these topical application creams without the prescription of doctor is a big no. But a very normal practice that we have in our society, doctor, I'm sure you are also aware, and you also get patients like that who go for home remedies, who go for over-the-counter applications, who go for over-the-counter, medicines, and then there are so many influencers over various social media platforms, and they are also endorsing products, and many times we fall for that as well. So how bad it is for our skin? What are the major side effects?
Do it yourself procedures at home. Sometimes they're giving good results, but most of the times they produce a lot of side effects. It is better to do anything for your face only after a dermatologist's advice. Without using a dermatologist's advice, there can be a lot of complications. When we use GIV products at home or other over-the-counter medications, it can cause more dryness. Usually in South, people apply turmeric. Turmeric can cause photosensitivity. Photosensitivity meaning it reduces itching and burning when exposed to sun. It can also produce dryness. These over-the-counter medications have a lot of side effects like they produce redness of the face, dryness, more pimple-like eruptions of the face, more hair growth on this area, and the skin becomes paper-like on using them for a longer period of time. So on using topical steroids, they can be excess hair growth on the face. So it's better to consult a dermatologist and do everything for the face.
Fair enough. Now, doctor, as you said, it's very dangerous and harmful for our skin, for our health, to use the creams that are, sold over the counter without any doctor's prescription, without doctor's follow-up. Now, my question to you is that, we in our society, there's so much of obsession of getting a fairer skin. And for years, we are in the name of fairness creams. I'm not taking any names, but then in the name of fairness creams, we are using steroids for a long, long time. And when they get melasma, how difficult it gets to treat them.
So for melasma, topical steroids in combination with hydroquinone tretinoid can be given, but only under dermatologist guidance. Topical steroids, if given for a long time, it will definitely cause redness, pimple-like eruptions can occur, skin becomes very thin, excess hair growth can occur, photosensitivity can occur. So similarly, hydroquinone compounds can cause a condition called exogenous sulfurosis, which means the skin becomes more darker. Retinoid can cause retinoid dermatitis, which means redness and photosensitivity can occur. So sometimes people use this without doctor's recommendation. They see good results over the time, and once they stop it, again the blackness occurs. So rebound hyperpigmentation usually occurs when stopping these medications. So it is better to see the doctor and start them for the prescribed period of time and stop on doctor's advice.
Right. So as soon as you see these spots or anything which is not normal on your skin, please go to the right person, which is a qualified dermatologist. Don't fall for various products, various brands, various over-the-counter applications. Don't fall for quacks as well, because quackery is also rapidly increasing, doctor. And there are, parlors, quacks, etc. They claim that they have procedures for treating melasma, but then they don't have any qualified dermatologist with them. How dangerous it can be if we fall for these parlor treatments or packaging.
Yes, it's absolutely dangerous. The parallel people and clocks are using some chemical peels. Patients are not even told what the chemical peel is. Higher strengths of peels are used. It burns the face and the melasma becomes more worse. Similarly, they're prescribing triple combination creams without knowing the side effects. Patients are using it thinking that they are qualified dermatologists, and again they end up with worsening of melasma. So it's better to meet a qualified dermatologist.
Right. Doctor, initially you also said that in case there is a family history of melasma, then, there are more chances, the risk increases. And thus, we would like to know what could be a preventive strategy in case there is a family history of melasma.
If there is a family history of melasma, sunscreen is a must. Sunscreen is a must. Definitely, sunscreen will help in preventing the occurrence of melasma or at least delay the occurrence of melasma. So, proper sunscreen usage 15 minutes before stepping out of the home and reapplying every 3 to 4 hours is a must. At least two finger rule for the face and neck. That is two finger rule.
Okay.
From the tip, from the tip till the end of these two fingers, the pointing finger. The sunscreen has to be applied over the face and neck and blend with the skin color.
Right. Many times people say that, I'm not going out, or I'm just working from my home in front of my laptop most of the time. Why I need to apply sunscreen on a regular basis? But with what you are saying, I can make it out that we need to use sunscreen on a regular basis, right?
Yes, they have to wear sunscreen even when indoors and even when using mobile or laptop because mobile and laptop emits a light called blue light. Blue light can cause more of aging and more of melasma. So sunscreen is a must. 365 days the patient has to have the sunscreen either indoors or outdoors. Sunscreen has to be worn, particularly when sitting in front of laptop or mobile phone. Sunscreen is a must.
Okay. And what are the basics that we should look for when we are going out to buy a sunscreen, doctor?
Sunscreen is better to get the broad spectrum sunscreen, both UVA and UVB. Combination sunscreen, both physical and chemical sunscreen. PA should be at least 3 plus. PA means how much it gives protection from UVA. And the SPF should be 50 for melasma. SPF means how much it gives protection from UVB.
So, doctor, we were talking about sunscreens, and another very common, thing that we see with melasma is pregnant ladies getting melasma. So, we would
Yes,
like you to
yes.
shed some light on that.
Pregnancy, melasma is more common. It is pregnancy, it is called as colosma, which means mask of pregnancy. In pregnancy, there will be hormone changes, increase in progesterone and estrogen. So all these hormone changes contribute to melasma during pregnancy.
Right. And during pregnancy, again, over the counter medications are a big no no. So, in case you are pregnant and you have melasma, or in case you are lactating, you have melasma, please go and consult a doctor. Please go and consult a qualified dermat. It becomes even more important to do that. Doctor, we were talking about melasma, and so many viewers have so many questions regarding melasma. I'll take them one by one.
Mm.
Monica Sharma is here, and her question is: are there lifestyle changes or habits that can help prevent melasma from worsening?
Yes, definitely using sunscreens and physical protection like the caps, umbrella while going out in the sun. Proper usage of sunscreen, like two-finger rule, 15 minutes before stepping out, every 3 hours once application will definitely help preventing the worsening and delaying of the occurrence of melasma.
Hmm. Many times people take melasma as a sign of aging, and they'll say that, see, I'm aging, so I'm bound to have these spots and patches, and it's okay. I mean, probably there is no treatment or anything. So that's what they feel, and they don't go to a doctor. How would you like to address this problem, this thing, doctor? Plus, because it also impacts us psychologically on an emotional ground too, because definitely our appearance is on stake.
Yes, melasma usually starts appearing in the late 25s and 30s. So it is definitely one of the signs of aging. When the patient start crossing 25, 30, in some people melasma occurs and it indicates signs of aging as well. Yes, it impacts the quality of life. Some people are very much depressed and anxious to go even public places. They don't even want to calm a pleasure. They just want to get rid of it immediately within a few days, which is totally not possible. So there is a scale called Dermatology Life Quality Index. 10 questions are given, and each question is given a score of 2. When the when the sum of the points crosses the needed points, it is said that melasma has severely affected the quality of life of the patient.
Right. I'll take one more question. This is by Shreya. Her question is: how does stress management play a role in melasma management?
Yes, in case of any hyperpigmentation disorder, stress is a big no because stress increases the level of cortisol and there's increase in the production of alpha MSH, which is the melanocyte stimulating hormone. So this hormone stimulates more pigmentation. When patients are stressed, it's going to again adversely affect melasma. So it's better to de-stress themselves, concentrate themselves in different activities.
Hmm. Doctor, does melasma get cured permanently? That it's done? I mean, it's cured and it won't come back. Does this
There is no
scenario happens?
Yes, there is no perfect cure for melasma. We can just keep it under control. Initially, we have to hit it hard. Use sunscreens, topical agents, oral agents, chemical peeling or laser. Once it comes under control, we have to maintain it. Thinking it has gone and if we stop sunscreen and other topical agents, definitely recurrence is a rule. So to prevent the recurrence, we have to maintain it. So we have to switch over the topical agents to a lighter note and maintain it. But sunscreen has to be continuously used.
Right. So we can control it. Thus, it becomes even more important to approach a doctor as soon as you start seeing some spots, some freckles, etc. Before they spread, become large. Go to a doctor. Start using sunscreen as soon as possible and make it your routine. I mean, just the way brushing our teeth just when we get up is a routine, a behavioral change that we all have. Make it that important part of your lifestyle. That is so important. And along with the sunscreen, can we also use the physical barriers, doctor? Yeah,
Hello?
doctor, we would like to sum up the
Um,
whole session. And
1 minute.
yeah, sure. So we are talking about the how to manage melasma and how important sunscreen can play a role in preventing and also works as a treatment procedure. So yes, doctor, we would like to sum up the whole session, and in the end, if you would like to tell anything to our viewers or any do's and don'ts for melasma.
Yes, if you start seeing any brown patches on your face, it is better you go and immediately consult a dermatologist immediately. Don't Don't go followed. Use sunscreen religiously. Use the topical agents given by the doctor. Do chemical peeling or laser as advised by the doctor. Properly follow up with the doctor. Don't stop on your own or don't continue any medications on your own. Don't use any over-the-counter medications. Uh, Once the melasma comes into control, just try to maintain its sunscreen and the other agents which are given by a doctor. If any doubt, you can consult your dermatologist. Don't Google up and mess up with it.
Right. So please go and consult your doctor, your dermatologist. That's really important. Don't experiment on your skin with over-the-counter applications, medications, various products, etc. That can worsen your skin condition and your melasma. So please go to the right person, which is a qualified dermatologist. Thank you so very much, Dr. M. Preethi, for your valuable time. It has been a very informative session for our viewers, and it was great to hear you. And we really look forward for many more such sessions for our viewers in coming times with you.
Thank you. Thank you.
And thank you, Doctor. It was a pleasure. And viewers, thank you for your participation in today's session. Stay connected to our beautiful Spotless Skin page. Have a great day ahead. Goodbye.